Hi, my name's Emily Sieg, and I'm the Director of Neurotrauma at U of L Health. My father is an academic, and he loves what he does. To him, work has never been anything other than pleasure. And I always wanted to find the same kind of fulfillment in my career. And so I went through most of college thinking I would follow his footsteps. I was actually a psychology major, intended to get a PhD. And then towards the end of college, ended up doing some volunteer work at a hospital and really enjoyed patient interactions, and so found that I was much more drawn to that. So I ended up in my last few years of college becoming a volunteer EMT and spending a lot of time volunteering at the hospital in Pittsburgh where I was, and then ultimately did a post-bac and decided to go to medical school. I am a neurosurgeon here at U of L. I do most of our brain and spine trauma, so I'm based primarily at the main University of Louisville hospital and see patients with both blunt and penetrating brain and spinal injury. I try really hard to bring some semblance of control to the families and the patients who are here. I can't imagine anything more terrifying than having a severe traumatic brain injury. And so I try to kind of work and build support for the families in this setting and introduce them to survivors of both brain and spinal cord injury to help motivate them. I try really hard to always be truthful with them and to never kind of paint a picture that isn't the case, but also to help them understand that this is going to be a long journey. Recovery from a traumatic brain injury is really a lifelong thing. It takes months to years, not a couple of days in the hospital. And so I try to prepare them for that journey and collaborate a lot with our physical medicine and rehab colleagues who will then take them over and care for them at Fraser. We really have been working on building the neurosciences component, both in elective practices and in our trauma base, and working on improving the technology that we have there, improving communication between the trauma teams and the critical care teams and our neurosurgical teams. I am an avid cyclist, so we road bike a lot. It is one of my favorite non-work activities to do, because when you're out riding, you can't be lost in your brain thinking about all the stressful things in life. So I use that as kind of my biggest relaxation. I think it's important for everyone to have balance in their life. I think I'm better at my job when I'm able to find other avenues to kind of relax and do other things. And a family and people who support me around is what's gotten me through medical school and residency, and now through my career here.